Hi, I'm Dr. Tanveer Janjua, and today I want to talk about TMJ, pain and injection treatments. TMJ is a very common disorder. TMJ stands for temporomandibular joint, which is a jaw joint at the junction between the skull and the jaw. Unfortunately, there's a lot of people who suffer from pain in that area, which can go undiagnosed for a long time and can be perceived as an ear infection or ear pain or a headache or neck pain. After all the other causes such as sinus infections, ear infections, brain-related injuries, neck-related injuries have been ruled out, and we have specific points of discomfort and pain in the TMJ area, we can help those areas by injecting with a mild steroid called kenalog, also known as triamcinolone. Those injections are steroid injections, so you must discuss with your doctor prior to having those injections the risks and benefits. However, once you are cleared by your doctor and you receive those injections, it helps to take away the inflammation for up to 3 months in my experience and gives you the proper relief. I cannot overemphasize the importance of making sure that you do not have any other medical condition that could be contributing to it. Many a times I have found patients who had chronic sinusitis or they had ear problems that were leading to clenching of the jaw and in result TMJ issues. So let's take a look at Lauren. She has TMJ problems on the left side, and this is the side that bothers her a lot, and we have ruled out all the other conditions. So I will give her TMJ injections to relieve that pain, and I will be showing with a close-up exactly the area that we will inject. Typically in my TMJ patients, I have found 3 critical locations where the pain is intense. The very first one is the TMJ itself right here, and this area is easy to identify and palpate. If you place your finger in front of the tragus, this little nub, and then you ask the patient to open and close their mouth. Lauren, could you open and close, please? Again. Right there, perfect. So right there, does it hurt you? Okay.
Yes.
So by opening and closing, you feel the joint opening and closing, you can easily identify the TMJ. That is one of the areas where you can inject. The second area I find painful is retromandibular area, which is behind the ramus or the upper part of the jawbone, right around here. On the surface, it relates to where the earlobe meets the cheek. So if you place your finger and you push behind that area till you feel the bone, that would be retromandibular area. And if you notice, I am pointing anteriorly, which is forward. Lauren, does this hurt here?
Yes.
Okay. So that is the second area, retromandibular. Third area is right underneath, between this muscle, the sternocleidomastoid muscle, and the jaw. If you go in between the 2 areas and you gently push as if you're pushing deep inwards, this time I am pushing towards the midline or medially, and you can palpate the soft tissue at the stylomastoid area. I'm sorry, obviously that hurts. Okay, so that is the third area. Now you have to understand this is close to the base of skull, which medial to the styloid process is a very precarious area with carotid artery, internal jugular vein, facial nerve, and makes it a very tricky place for placing any injections. I would strongly advise you not to attempt injections in that area unless you feel comfortable with the anatomy and have been trained appropriately. But those are the 3 critical areas for injection. Today I will inject those 3 areas with kenalog using 5 milligrams in each place. I use kenalog 10. I do not use kenalog 40, which is quite strong. Kenalog 10, I need to use 0.5 cc's, which is equal to 5 milligrams. So I will be using 0.5, which is half a cc, in the temporomandibular joint, in the retromandibular area, and in the stylomastoid area, and I will demonstrate that in a minute. We use alcohol to clean the area really well. This is kenalog 10, and you have to make sure that you agitate it for a smooth distribution of the liquid, otherwise it precipitates. So you have to agitate it just before drawing. We use a 30 gauge needle. This is a long 30 gauge, which is about an inch long. So it's 30 gauge, 1 inch long needle, which is very, very fine and makes it quite safe. And the most penetration you will have through skin is going to be 1 inch. And as long as you don't push it further in, you are very safe and you will be able to stay away from the critical structures. We'll start with the TMJ joint itself by palpating to find the joint space. It's important to have the patient open and close their mouth to identify the space. Lauren, can you open your mouth, please? Close. Open. Keep it there. So now that I've identified the space, I'll have the patient keep their mouth open so I can enter into the joint space and then inject. Great. If you get any clogging, you can always change your needle to a new one and then put it back in again. Open, close, open, close, open, keep it there. Thank you, you can close. How are we doing so far?
Good.
Good, okay. Next would be the retromandibular area, pointing anteriorly, you feel right there. And the last one will be in the stylomastoid area. Do you feel this, Lauren?
Mm-hmm.
Tender? Okay. It's always important to aspirate quickly before injecting in the stylomastoid area. And if you get any blood coming back, then you must stop. We're all done at this point. Gently massage that area. It typically takes 2 days, 48 hours before you feel any relief. And after the injection, patients usually feel more uncomfortable and have more pain today and the next day. So it's important to explain to the patients to take Motrin and stay on very soft food for the next couple of days and use some warm compresses on this side as well. I do have an instruction sheet that I give to my patients for TMJ, and it is available on my website, which is janjuafacialsurgery.com, and that is one word, and I hope it helps. And again, please remember to evaluate the patient for any conditions which are predisposing the patient to clenching and then in turn causing the fatigue and tenderness of all the tendons that are attaching the muscles of swallowing, that's deglutition, to the jaw area. I thank you for your time. And Lauren, thank you for your patience.
Thank you.